Hickman, we're going to be assessing all 12 cranial nerves today. First, we're going to start with cranial nerve 1, which is the olfactory nerve. So I'll have my patient here occlude his left nostril and close his eyes, and we will be testing his sense of smell. So can you smell that?
Yes.
All right, we'll switch to the other nose. Can you smell that?
Yes.
Great. All right, and we're using garlic powder today. So we're testing to see how well he can smell it. It smells equal between the noses, is that correct?
It does.
Very good, so that's a normal response. Next, we're going to be testing cranial nerve 2, which is the optic nerve. So with this one, I'm going to have my patient look out at the chart here, and we're going to be testing the pupil response. So first, we're going to start with a direct test. We have great constriction right there. We're going to be testing the other eye. We have great constriction right there as well. So we have normal response of the optic nerve. All right, now we're going to be testing cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the adducens. All right, so what I'm going to do is I'm going to be doing the physiological age to be testing the sensitivity of these nerves. So I'm going to get my patient to look right here at this light, and I'm going to get him to follow it without moving his head. Great, fantastic. He had great movement with all positions of gaze, and that is a very normal response for all of those. Next is cranial nerve 5, the trigeminal. So what we're going to do is first we're going to do the motor first. So I'm going to get my patient to clench his teeth together. I'm going to palpate the masseter muscles. Those feel equal. Very good. You can relax. And then constrict again with that muscle. Clench your teeth there. We're going to be feeling the temporal muscle there, and that feels equal as well. So the motor seems to be functioning very well. All right, also with cranial nerve 5, we're going to be testing V1, 2, and 3, which are the sensory portions of the nerve. So I will use the other opposite side of a Q-tip. And do you feel that right there? We're going to start with V1 up on his forehead. And do you feel this okay?
I do.
Great. And then we got the cheek and then the jaw. Do you feel the jaw?
I do.
Right there? Awesome. We're going to be testing the other side too. Can you feel that?
Yes.
Great. That's V1. And here?
Yes.
V2. And right there?
Yes.
Fantastic. V3. Everything seems to be normal. All right, now we're going to be testing cranial nerve 7, which is the facial nerve. All right, so for this one, we're going to be doing different expressions. So first, I want you to raise your eyebrows for me. Fantastic. Now I want you to close your eyes really tight, okay? I'm going to see if I can open them. And those stay closed very well. All right, next one, I want you to show me all your teeth. Fantastic. All right, and the last one, I want you to blow your cheeks up for me. I'm going to put some resistance on them, see if you can hold that. Awesome, that's great. So that's a very normal finding. All right, next we're going to be testing cranial nerve 8, which is the vestibular cochlear nerve. All right, so for this one, we're going to be testing hearing. So I'm going to have my patient facing forward, I'm standing behind him, and I'm going to be rubbing my fingers together. I want him to indicate which ear to next to, okay? Great. Great. Fantastic, and that's a normal response. Next, we'll be testing cranial nerve 9, the glossopharyngeal. So I'm going to have my patient open his mouth and say, ah, for me.
Ah.
Great, one more time.
Ah.
Awesome. I'm looking at the uvula and the soft palate to see if it's raised in symmetrical movement. All right, after that, we're going to be testing cranial nerve 10, which is the vagus. So have you noticed any hoarseness in your voice or any changes at all?
No.
Fantastic, and those are both normal responses. All right, next is cranial nerve 11, the accessory nerve. So what I'm going to do is I'm going to be applying pressure to my patient's shoulders, if you could raise them up for me. And we'll be applying resistance and see if he can push against that, and that's great. All right, this next one I'm going to be seeing if he can apply, I'm going to be applying resistance to his cheek and see if he can push against that. So if he could push towards my hand for me, great. And then how about over here? Super. All right, and there's normal responses there as well. All right, the last one we're going to do is cranial nerve 12, which is the hypoglossal nerve. All right, so for this one, I'm going to have my patient stick his tongue out for us. Great, and then we're going to go to the right. Awesome, and then to the left. Very good, and that's even symmetrical movements there. All right, now I'm going to be putting my hand against his cheek and apply pressure with your tongue. Great, fantastic. And this other side, very good. All right, and that's a normal response there. All right, we assessed all the cranial nerves and they were all within normal responses.